We offer a full dental implant service here at our practice, which includes from the initial treatment planning, to placing the implant, to restoring the implant, and finally looking after the implants. Any adults who have got missing teeth, they can benefit from having dental implants.
Before the treatment, my teeth were okay until I had problems with my front tooth.
I had a missing tooth for years, and that was making the eating very difficult.
I would hate the idea of having a denture that you need to take out.
For years I'd had 2 crowns, and one of them was starting to look discoloured.
An implant is an artificial root which is mainly made of titanium, and to that you can connect what we call an abutment, which just goes on the top of the implant, and you have a crown that goes on the top of that. So it basically consists of 3 parts, and what that will do obviously will give the patient back the tooth they lost. The implant, I think, is the best way to replace any missing teeth is not depending on any other teeth.
If you have a bridge, then the 2 teeth on either side are having to be ground down, whereas if you have an implant, it's just on its own.
We take our time with our planning. We need to make sure that everything is right for the patient, and that basically requires a teamwork between the surgeon, the patients, the dental technicians, and of course the hygienist group. And all that teamwork will allow us to give the patient the best treatment they can have.
The care I received during and after the implant was very, very good. Ali described every stage to me.
It just made me feel very comfortable.
There were no surprises, I knew exactly what was happening.
If the patients follow our advice by coming regularly for the dental checkup and see the dental hygienist, there's no reason why a dental implant cannot last as long as a natural tooth.
I had several consultations to make sure everything was fitting well.
We have, at the dental implant practice, have got a vast experience in dealing with the different clinical situations when it comes to dental implants. We offer everything under one roof, so we know exactly what we have to do from the early stage of planning to the final stage of putting the final crown on it.
I think probably the best thing about the implant is that you don't think about it.
It's just like my own tooth.
Now I can eat better.
The colour matching, everything, I was delighted with.
Talking with anybody, I don't feel as though I've got to hide my teeth anymore.
To give that confidence back to a patient who had lost interest in eating, that feeling is exceptional.